where you are. There are so many demands on you. Demands at home, in the boardroom, and in the bedroom. You have to be jack of all trades, wearing a different hat when the moment arises. You're on all the time, always on the clock, always catching up. Take care of you. Introducing Your Media, your podcast network that meets you where you are, when you need it, at your time, in your space, when you feel like it. You come first. Your Media, where you are. Getting up close and intimate. Totally Not Taboo with Tracy. Celebrating sexual positivity both in and outside the bedroom.
Hello, all our beautiful listeners, and welcome to another episode of Totally Not Taboo with Tracy at Your Media, hashtag where you are. This is a place where we get to talk about everything that is taboo around sex and sexuality. And I hope that everybody's keeping warm on this freezing cold day in Johannesburg. And apparently, we've got even colder weather in store for us coming up this week. So, snuggle up on the weekend with some hot chocolate and hopefully a very warm body beside you. So, in our studio today, we have Sharon Rosen. And Sharon is a social worker in private practice. She specializes in sex addiction, and sex addiction is something of a taboo. Not many people really know that sex addiction is classified as an addiction. We usually associate addiction really with drugs, alcohol, gambling. Even that is still really not generally classed under addiction. We usually, you know, think about addiction. We talk about drugs, alcohol, and and the like. So sex can be referred to as an addiction, and so we're going to speak to Sharon a little bit more about what she actually does. So, without any further ado, I would like to introduce Sharon. And Sharon, welcome to our podcast. And I would love you, please, to introduce yourself to our audience and tell us more about what you do and who you are.
Hi, so I'm Sharon. As Tracy said, I'm a social worker in private practice. I've been working in addiction probably about 30 odd years. And in the last about 12 to 13 years, I've been specializing in sex addiction. I kind of have moved to sex addiction, or let's say I got interested in sex addiction when I started seeing, understanding that, like a lot of cocaine addicts, for instance, were also acting out sexually, and then understanding which was the primary addiction and which was the secondary addiction. And a lot of the time, actually, when you take away the substances, the sex is still there, and that then became the primary addiction. So it was kind of like overshadowed by what we knew as the substance addictions. And then we started understanding more and more that sex addiction can be an addiction of its own as a primary addiction. It's considered more a process addiction as opposed to a substance addiction. So it's slightly different, but yeah, it's held my interest, particularly because the people that I work with, I identify with their level of shame so much because they've got no understanding from the rest of the world. Society doesn't understand it. You can't go to an SAA meeting, like a Sex Addicts Anonymous meeting, and hold your head up high that you're in recovery, like an alcoholic can go to an AA meeting and hold his head up high because people congratulate them. You're an addict in recovery. People, sex addicts who are in recovery, they just think cis, gross, pedophile. There's such little understanding about it and such terrible shame that these people have. So yeah, I'm just very empathic towards them, and I would they really hold my heart, and it's an area that I love working in, predominantly because I have a history of shame, and because sex addiction is you can't say sex addiction without shame in the same kind of sentence. And so I identify them very much on the shame level. And
Mm.
that's what I love. It's my passion.
So, the way I understand addiction, because I also have a history with addiction, is that there's a lot of shame around all addiction. It's kind of what gets us into the addiction, into the cycle of substance abuse. So I use the substance, which makes me feel shame, which makes me want to use the substance again to um, numb out the feelings of shame. So then I use again, feel shame and guilt again, which makes me want to numb the feelings again. And so it's this vicious cycle.
Yeah, but if you take that with shame with a substance addict
Mm,
and you times it by 10, that is the shame that a sex addict feels. Because with sex addiction,
mhm.
it's so much around your body and around sex. And, I mean, we're talking on totally not taboo. Sex and your body is, that's where shame originates, really. So,
Absolutely.
yeah, as soon as you're dealing with something with the body or sex, shame can just be multiplied and multiplied.
Absolutely. I get that so much. And especially as you said, because the body and sex is our absolutely, we get shamed around our bodies from as young as childhood, as within the first 8 years of our lives. Somebody has to look at us sideways or comment on anything concerning our bodies, um, and our sexuality. Gosh, tell me more about that. I mean, I've got my own views about that, but I really want to hear it from you. Um, this is something that is so close to my heart as well, in terms of women and their body images, as well as men. We think that women only suffer from guilt and shame around their bodies, but men do too.
Yeah, so with sex addiction, more often than not, some kind of trauma has happened early on in life. By the ages of 2, addict has to have been raped in early age, early childhood. It doesn't have to be something as traumatic as that, but it needs to be some kind of a negative or a problematic association that's set up between acting out with sex and and feeling a feeling of self-soothing. So I'll give you an example. So a little boy
Yes.
goes off to preschool, and on his way in the car, his mom and dad are fighting. So he gets to school and he's very, very, very anxious. And all the kiddies are going up and down, on the fireman's pole. And he has a turn and he goes, and then on his way down, he feels this wonderful sensation in his groin. And then he
Mm,
associates that nice feeling with the anxiety. So next time he feels anxious, he goes and seeks out that pole. And so that feeling then gets generalized. So whenever he feels anxious, he does some kind of sexual soothing. And then when he feels angry, and then when he feels happy, and he'll always then want to go and soothe some kind of sexual soothing. And then instead of just using the pole, he'll eventually go and rub himself against the table, and then maybe start masturbating. Or so that is set up from a very, very early age. And because there's that conflict of feeling, like how can I be feeling so bad, anxious or angry or whatever, and this feeling in my groin feels so nice? It's that conflict, and that sets up the whole blueprint of shame and sexual acting out and escape from normal kind of feeling.
mm.
Does that make sense to you?
Absolutely. Well, it makes sense to me because I understand it. And what I also understand is the fact that um, kids before puberty don't experience ejaculation and orgasm. So they just feel, as you said, like a pacifying effect. Like it would be the same as using a dummy or a blankie, to soothe. Um, So when parents freak out that their little girl is rocking on a cushion or a fluffy doll or something, and this little girl is just rocking because it's soothing, it does feel nice in her genitalia, but she's just soothing, self-soothing. They freak out that she's going to have an orgasm, but she's not able to have an orgasm because she's not pregnant yet. So I get that idea, and that's something we need to actually educate parents about. Am I hearing you correctly?
Yeah, but it's not even so much for the orgasm or the ejaculation, because actually, some of the people that I've seen, they say that before they hit puberty, they were already having what they understand now in adult years as an orgasm. And some even say, some guys that I've spoken to say that they ejaculated. So I'm not sure on a physiological level whether it can or it can't happen or it's something that's similar to or not, But it's not even about trying to get to the orgasm. It's about the zoning out that the person has while they are soothing. So, for
So
instance, somebody who is addicted to pornography, their
yes.
main thing is going for hours and hours and hours, scrolling down and looking for the perfect shot, etc. But that zoning out, where they lose the hours, is what they're addicted to. They actually stop themselves from having an orgasm because once they have the orgasm, then it's finished. And that's not
Yes.
what they are looking for. They're looking for that long zoning out period.
Yes. Let me ask you, could that zoning out, excuse me, could that zoning out period be like that disconnect from self?
Yeah, yeah. So it's what most addicts really go for. It's an
Mm.
escape from reality. It's an escape from present, and even like nice feelings, excitement or feeling good about yourself. Sometimes it's just too intense because an addict has along the way during childhood has not been taught how to deal with feelings. You can't cope with feelings.
Right.
It's better to just act out. So in other words, if a little boy falls and hurts himself, his mother will quickly come with an ice cream or some kind of distraction. There, it's okay. Or if he's very sad, the mother will try and take the child into a happy place. The child is taught that they can't bear those extreme feelings or unhappy feelings, and so they need to act those feelings out. So from a young age, they find some kind of behavior to take them away from their present uncomfortable place. And a sex addict
Right.
finds sexual kind of things. But sex addiction is not about sex, actually.
Right.
Sex addiction is more about an inability. No sex addict can has got the capacity to be intimate. They don't understand what intimacy is, but they have a vague notion of intimacy, and it's something that they're searching for and longing for all the time, but they can't actually get it. So the sex addiction is actually a need for that intimacy. And they think that they're going to get the intimacy through sex, but they don't get it. And also
Right.
sometimes they have this vague notion that what they have with their partner maybe is intimate and it's just too intimate for them. And they can't bear it. So they will then, instead of having sex with their partner, they would go to a stranger and have have sex with them, so that there isn't that intimacy issue. Yeah, do you understand?
Mm. Yes,
So they want
absolutely.
intimacy, but they can't deal with the intensity of intimacy, and it's something that's just there that they're running after all the time, but they can't actually ever reach.
Mm, absolutely. And again, I go back to that disconnect from self, and trying to fill that hole,
Yeah,
um, which actually, so one would need to teach that person how to connect with self, sitting with the pain, staying in the uncomfortable feelings, sitting in the
yeah,
discomfort of hurt, pain, um, sadness, instead of searching for the gratification, which is not, as you say, is not in the orgasm per se, because then it's over. Am I right? Is that what
Yeah,
I'm hearing you
yeah,
say?
yeah. No, that's completely correct. Yeah. And again, even so, I've given you the example of a pornography addict, but for
Mm.
instance, somebody who's addicted to going to sex workers, the whole finding somebody, getting going there, having this whole fantasy of everything, that is more of the big deal for the person. And then once
Yeah,
they've had sex, they want to leave immediately because they feel dirty, they feel disappointed, they feel desperate, they feel all those other horrible feelings that comes from the orgasm, or that comes after the orgasm. It's all the
right. And
other
that's
time that we're really looking for.
right. And that's the guilt and shame.
Yeah, yeah.
Right. This is incredibly interesting. And I want to know more. What about pedophilia? Is that classified as sex addiction?
Not in the slightest. And this is really where people really, really, really need to understand that
Mm.
most sex addicts are 100% not okay with anything to do with children. It's a completely different thing.
Right.
Most sex addicts, they are amazing fathers. They've got wonderful ethics. They would not cross over that like violation to a criminal act and a completely unethical act of having anything to do with children. The one doesn't have anything to do with the other.
Great. So I'm glad that we've cleared that up. Any other
Yeah,
misconceptions about sex addiction?
I think there are lots. I'm just trying to think what there are now. That sex addicts rape. And you know, so yeah, so rapists are more about the control and force over the other. The intention is to have power over the other person.
Right.
With sex addiction, it's not like that at all. They actually often feel powerless anyway. But it's not about the intention to hurt the other person or to have power over the other person. The intention is really just for me to get my own medication, which is my self soothing, which I get from what you're offering me or from the pornography or whatever. It's about me, the addict. It's got nothing to do with the other person. And that's one of the things that I have to try and explain when I'm working with a couple. Because I predominantly work with the sex addicts, and most of the sex addicts that I work with are men. But I usually bring the wife or the partner in as well, just to explain what the sex addiction is about and give a collateral point of view. How is it for the partner, etc. But one of the first things that I say to the partner is that it's got like good and bad. It's actually got nothing to do with you. It doesn't
Mm.
mean that he doesn't love you less. It doesn't mean that he was thinking of you also. It's got nothing to do with you that he needed this fix. So in a way, it's like saying to her that he didn't have her on his mind when he was going and doing whatever he was doing, which is heartbreaking for her. She's saying, "How can you not think of me?" But on the other hand, it's also that it really has nothing to do with her. So that if she would have given him more sex, if she would have given him more blowjobs, if she would have, maybe he wouldn't be a sex addict. It takes her off the hook completely because there's nothing that she could do or say that would affect him. His sex addiction is entirely up to, it's about him. It's got nothing to do with her.
Mm. Get that. And something interesting. How come there's a high prevalence in men, sex addiction?
Sorry, I didn't hear you. How come?
High prevalence in men of sex addiction, mostly among men.
So, okay. So I think it's much higher in men. First of all, sex addiction is higher in men, but women can be sex addicts as well. But I think with women, it's more predominantly codependency and love addiction. So, and love addiction is slightly different to sex addiction, although they They can be one of the same. But love addiction is more around the fantasy of, I will do this, I will give this person sex because I need them to love me. Sex
Right.
addiction can really just be around the sex. I want to just go and fuck that person and then it's finished. With love
Mm.
addiction, it's I need to be needed and they love me, and so, and that's what women are better at. They women are much more into this codependent thing of I need to be the savior and the nurturer, and they get it through the sex.
Right. And maybe he'll love me more.
However, there are many men who do the love addiction as well. They've got fantasies about they will go to sex addicts, and their fantasy is that sex workers. Their fantasy is that they're going to this particular sex worker and making her day better by massaging her instead of her giving him sex, or by listening to her story because his fantasy is that he's this really good guy and she loves him and he's making a difference in her life. So you get those kinds of sex addicts as well.
Interesting. Wow, this is such an interesting subject. At this point, I need to just take an ad break, if you'll just bear with me. Thank you so
Okay?
much. So, we all know that summer bodies are built in winter, but that can be easier said than done. So, why not join fitness expert Mo on the Health Fix with Mo for an inspirational weekly fitness podcast show for fitness novices? Mo chats to the best in local health and fitness experts in an effort to get information to help you achieve your aesthetic, fitness, and health goals. Subscribe on YouTube, listen on any good podcast platform, or find it on www.yourmedia.co.za. Your Media, hashtag where you are. Thank you, Sharon. So, what I also want to find out is when you're working with a couple, how many, it's like how long is a piece of string? But you would work predominantly with the sex addict, and then you would bring the partner in. How many sessions would you
So,
say that it would take for the partner? Yes.
okay, now, so what I do
To,
is I actually like, if the person is in a relationship, I like the addict to come together with their partner for the very first time or for the second time, but right early in, so that I can hear both points of view and understand exactly what we're dealing with. Then I try and already at that stage just do a little bit of education, because sometimes the wife is saying, yo, I want to get divorced now that I know all of this. And I try and say to her, just hold it for a moment, because now, for the first time, he's going into therapy and we can deal with this. You've been living with a sex addiction for so long already and you didn't get divorced, you didn't even know about it or whatever. Now that he's going into therapy, give it a chance, but it's going to take a while. And we also need to get support, and because this is a very difficult thing. So I try and get her to buy in to go to her own therapy as well. Because there's this whole codependent thing. It's not that he's the baddie and she's the goodie. And
mm,
often she likes to do that. Say, I didn't buy in, I didn't sign up for this, and I'm all good, and you're all bad, and you need to go and get yourself fixed up. And she will just blame, blame, blame. But I try and explain to her in as gentle a way as possible, because she's very, very angry at this stage, that she's also got her own issues that made her attracted to somebody who is incapable of intimacy and who's a sex addict. And that's
mm,
it would be really important for her to go on her journey to look at her stuff. So yeah, I try and get her to buy into therapy, and I would try and get her to refer her to someone, and then maybe like every 6 weeks or something like that, to get her to come back to the therapy, so we have a joint session, so she can give her feedback, how is it going, etc. The other
mm,
thing that it's really important to get her to buy into is a contract. So, and this I do with all kind of addiction, is that what are the behaviors that are acceptable and what are the behaviors that are not acceptable, and then what are the consequences. So in sex addiction, the recovery or the treatment plan is very different to substance addiction, because substance addiction, we know that if an alcoholic has any kind of alcohol, we know that that's a relapse. It's black and white. But with sex addiction, it's not necessarily so, because you may have a sex addict who is addicted to sex workers. He also exposes himself in the car to people. He also watches porn. He also, like a whole lot of things. So I can tell you that he's not going to be able to stop everything at that moment. So we look at a risk analysis. You know, the most risky is sex workers. So he needs to stop that. So we put that on the contract that that's a zero tolerance. If he acts out of that, his wife can tell him, I'm leaving you or whatever. But if you relapse on pornography, then it's okay, but we try. And so it's not giving them, letting them just get off with relapsing. They try as much as possible, but we look at different consequences for the different relapses. And then the wife needs to buy into that as well.
Okay.
And then for the sex addict himself, I usually say that it's about a 3-year period, because it's very long. Because as I said, it starts, that blueprint is formed when he's a young child. So it takes a long time to go back and do different, look at different coping mechanisms that the child has not been, well, that the person has not been using since childhood. It takes a long, long, long time to understand it and then to put it into motion.
You know, as you're speaking, I am always kind of comparing sex addiction with substance abuse, because that's where my experience is. But it's also a lot to do with food addiction, sugar addiction. I wonder, I'm getting a feedback. I wonder if our listeners can also get a feedback also. But it's almost like, you know, a child who feels bad about themselves will go and eat to feel to fill the pain. Sorry, not fill the pain, to distance themselves from the pain of whatever's going around. So I'll shove myself with biscuits and chocolates, and I don't need to deal with what's going on around me. And then, of course, what happens is, as adults, we need to stop eating sugar, because I have now a sugar addiction. But yet there's sugar in everything, and we need to eat. So with substances, it's black or white. Cannot touch a drink again, cannot touch a drug again, leads to relapse and so on. But we need to eat. Not only that, if we're doing sex right, with intimacy and with connection, and we're building the client up to understand that it's about connection. Intimacy is about connection. But as you said, you can't not allow some kind of sexual intimacy, even with self, through self pleasure, or and then changing the perspective. So this isn't about wanking or just jerking off. This is also a process where I connect to myself in a very positive, conscious way. But then, what about encouraging connection with a partner? No, we can't cut off. Sex is self-expression as well. It's a primal need. So I'm
So
also
that's
back.
exactly it. No, so Tracy, what you're talking about, that's why I said sex addiction is a process addiction. So another process addiction is food addiction. So how they
Correct.
differ from substance addiction is that substance, we're going for complete abstinence. For the
Yeah.
process addictions, for food and sex, we're going for healthy sex and healthy eating. And that's why it makes the journey, the recovery journey, so much more difficult, because you can't take it out of the person's life. You've got to teach them how to do something in a healthy way because you've been doing it unhealthily. So the person has got a dysfunctional relationship with whatever, whether it's food or whether it's sex. They are using it in a way that it shouldn't be used. They're using it in a way that is soothing and numbing, etc., as opposed to just for sustenance and for pleasure.
Mm.
And that's the biggest difference between process addiction and substance addiction. The one you're trying to get them to do healthy and incorporate it into their life in a different way, and the other is you're trying to get them to live without that substance in their life. Now, Tracy, you're absolutely going to kill me because we had this discussion before I came on live about needing to pee, but I have a bladder disorder and I seriously did not need to pee at the beginning of this, and I seriously need to pee now. And I'm so sorry to everybody, but please sing or do something. I will be 1 second, okay?
No
I'm so
problem.
sorry, but
I'll
I'll be
talk nonsense until you go. No problem. So while we're waiting for Sharon to come back, um, I would just like to maybe discuss, we'll just have my 5 cents worth about the body and shame as children. And I find that this comes up so much in my therapy sessions with my clients. And as an intimacy coach, I do see this quite a lot that children, oh, you're back. I didn't even get a chance to have my 2 cents say about as an intimacy coach and issues around body shaming. I was just saying that, with young women in particular, body shaming is a message that we get as really, really small children. And it could be in verbal or non-verbal ways, just a look from a parent, or it could be even growing up in a religious dogmatic home, or cultural home where it's not okay to have your clothes off as a young girl running around, that it's taboo to show your body. And we, as women in particular, we grow up with a lot of guilt and shame around our bodies. And yeah, it's sad for me. And I know that we're talking about sex addiction, but for me, it's also around body shaming, which very young children get a lot of that, especially religious dogmatic homes, and cultural differences, which I'd like to break that taboo. So
yeah, no.
while you were on a break, we can get back to sex addiction.
So,
So,
Katie, I wanted to
carry
come
on.
back to something that you mentioned before about that hole. You said about
Yes.
trying to fill that hole, because addiction is actually it's a disorder about not being able to have enough, not knowing enough. It's all about excess and extremes. And
Mm,
addicts cannot stop something because they feel that, oh, this feels enough. I feel full. I feel contained. It's like they can never get there. So it's with eating, you were talking about sugar before, it's all of those kinds of things. And with sex as well, they can have sex and still, oh, it's still not enough. It doesn't take away that hole. That hole is there forever. And it may take away that hole just for a moment in time, but then it's there again. And that's what they're running for all the time, with this illusion that this time I can fill the hole, but it never gets full.
mm,
And that's the inner process, the inner journey that the addict needs to do, because then they start filling that hole from the inside out this time. And that's why it's such a long journey.
mm. So, what is your method of healing?
Um, so it's about trying to explain to the addict about codependency, how through codependency they have developed only like a half a core, a half a place of a feeling of being, as opposed to a whole core. and that has developed because of their childhood growing up where the parents' boundaries have been enmeshed and it's been problematic, and they've been given too much affirmation for the roles that they play as opposed to who they are. And so
Mm.
they've been given a lot of external affirmation instead of being able to develop it internally, that I am good enough. It's more that you get praise when you do, when you perform well. So they never had the sense of what is good enough from inside. And so one of the things that we work with is moving away from needing that external gratification all the time to trying to give it to yourself internally. And I use the parent, adult, child paradigm a lot, where they start learning to talk to themselves from the parent ego state to that little child ego state and saying, you are good enough, it's okay, I can feel, nice, and I can let that nice stay in my being without feeling uncomfortable with it. And just getting them to talk a different kind of language to themselves, and getting a bit more self-reliant, that they can give themselves this affirmation through the parent, adult, child, as opposed to looking for it from without. Yeah, that's the main way. And then obviously looking at what the origins of this blueprint that was set up, letting them understand why it is that they behave like they do. So one of the examples that I always give, it works better for women than for men, but and then kind of understand it if they've lived with women as well, is that a woman who can be going absolutely mental, batshit crazy, and she doesn't know, and she's shouting and screaming and everything, and then all of a sudden she realizes, geez, I'm just about to have my period. And then, even though nothing else has changed, this recognition that there's a reason for why she's behaving like that, it brings a bit of calm, and she's not so crazy any longer. And it's a similar kind of thing. If you can try and understand the reason why you set up all of these defense mechanisms and dysfunctional behaviors, etc., then you can start bringing a certain amount of calm and changing in the behavior.
Well, that reminds me of the HALT idea, the
Mm.
principles. Am I hungry? Am I angry? Am I lonely? Well, angry or anxious. So it's hungry, angry, or anxious, lonely, or tired. And that kind of that's what I've learned to handle my anxieties or my issues around food addiction, alcohol, drugs, whatever it is that I'm dealing with or have dealt with, is to look at what is making me feel um, that I'm battling at the moment. And what we also, as you've just said, is that for women, am I premenstrual? What is making me feel like I need to act out? So that is very, very important to remember, to stop, put the brakes on, to pause and ask myself, halt.
Yeah.
Yeah. Um, so yes, and I love what you said about the overindulgence, the external stimuli that has always been that the child has always depended on and has never been able to reach inside and depended on themselves for strength, for nurturance, for coping skills. So they don't actually know how to self-soothe any other way.
And also
That
think
really,
about it, because they're so dependent on that external affirmation from other people. Think about how terrified they are every day they go out in the world and think, is there going to be someone or people giving me that gratification, giving me that air to breathe, or am I going to die today? Am I going to have to do handstands and so many tricks in order to get that? It's the most terrible feeling having to depend on external factors all the time. So they are constantly walking around with this internal terror, which
mm,
often people don't manage to feel fear. They feel anger instead of fear. So they're walking around actually very angry, but really scared scare people and acting out in a yeah, dysfunctional and really not good way.
This has been incredibly informative for me on so many levels. And I really appreciate you, educating me as well as our audience. And there's just one more thing that I really would like to know from you from a personal perspective is what actually got you to focus on sex addiction in your practice? Were you always interested in sex addiction? Did you slowly come into this? You've been practicing for many years. And when did your focus change? Did it ever change?
So, as I said, I started understanding that we were misdiagnosing a lot of
Mm.
substance addicts, um, or not diagnosing their sex addiction when they were really coke addicts, etc. And I've just had a long history with shame from early childhood stuff, going through various experiences around my body, and just shame was always my thing. And when I started working with sex addicts, I connected with them on that level immediately. I can actually see somebody like the shame dripping off them. I engage with them on that level. So it's very easy for me to understand that absolute dark shadow that a sex addict has, because it's that body shaming. And, body shaming is around food, it's about body, it's around sex, it incorporates all of those things. Not being good enough, being completely worthless. Yeah. And again, just, when I was younger, I also took lots of different drugs and medications just to numb myself out because I couldn't deal with the intense feelings of the present. So I'd had my own journey anyway, so it wasn't something that I was scared of.
Mm.
I'd also understood all the bullshitting that I'd done. So you say you can't bullshit the bullshitter. So I wasn't, I wasn't scared of going in and dealing with people's dark shame and shadow because I've been
Mm.
dealing with mine for so long. It's not something that I shy away from, and I know a lot of people do. They try and cover it up so that they make it all nice. I'd rather do the opposite. I go in there and I would say, let's get more and more, because
Yeah.
it's one of the most important things in working with shadows. I will say to the addicts when they come in, because they often say to me, just get rid of it. I don't want it, And I'll say, no, I'm not going to be killing your shadow, and I'm not going to allow you to kill your shadow. And anyway, you can't kill your shadow. What we want to do is just grow the lighter part of your personality so that shadow gets a bit smaller. But I want you in this journey, you're going to start shadow, and you're going to start forgiving shadow, and you're going to start seeing the goodness of shadow as well, because shadow can be amazingly charismatic and clever and funny, and you don't want to kill that part of you. You just want to get to know it a little bit better so that you can understand it and accept it, and then it gets quieter. I'd give that example of any mother knows or any parent knows of the child swinging and the mother's busy talking to her friend, and the child's busy calling the mom to say, Mom, watch me swing, watch me swing. And the mom keeps on talking, and the child's voice gets louder and louder and louder until the mom says eventually, Oh, yes, you're swinging very nicely. And then the child goes quiet again. And it's the same thing with shadow. As long as you try, push it down and you ignore it and you ignore it, shadow gets bigger and bigger and stronger and stronger. And that's what we don't want to do. We want to look at shadow and hear what shadow's been telling you all the time so that it eventually on its own starts getting smaller and smaller because it's been heard and it's been recognized and it's been forgiven and it's been, yeah, you can be empathic with it instead of so disparaging.
Judgment. Mm. I love that analogy of the shadow because even as I look at your face right now, I'm seeing the shadow and I'm seeing the light, the dark and then the light.
Uh,
And
yeah.
yeah, it's important that we see the light in everybody as well. And we point that out that there is a dark side of us. And then there's the bright side of us as well. We all have it in us. And it's important to know the dark side and to stop running from the dark side because it is part of us. It's who we are. So I absolutely love that. And I know I can learn so much from you, Sharon. Um, the other thing is drug abuse and sex addiction. I know that you spoke about them as being two separate things, but dealing with a lot of gay clients, there seems to be a very, very big um, marriage between them. We spoke about chemsex on one of our last couple of weeks ago, months ago even, that the chemsex, the use of chemical hard drugs, makes it almost impossible for these gay men to even have sex. They can't have sex without it. Interferes.
So, once again, that's why it's so important to see which is the primary diagnosis, because a cocaine addict, for instance, will have cocaine will have sex, but then will have cocaine to make the sex nicer, to make it higher, to rev it. But they can have sex with or without the cocaine, but they just enjoy it even more with cocaine, because once you're on cocaine, sex just becomes amazing. And that's what the stimulant addict is looking for. But the sex addict can have sex with or without the substance. But often the substance is there anyway. But only once they go into recovery and they take the substance out, they realize, shit, actually, I'm doing sex all the time anyway. I thought it was associated with the substance, but actually it's not so. You can very, very, very frequently, I've seen cocaine and cocaine users and alcoholics. So an alcoholic will go into rehab, say, because now his alcohol has got out of control, and he goes and he gets clean from alcohol, and he says, no, I don't need to get clean from cocaine. It's not my drug of choice. I can do it socially. But then he gets very into the cocaine because it's just really a cross addiction. The one is always there with the other. And it can be similar with the sex as well, but usually if somebody is a substance addict, all the sex stuff, the heightened sex will go once the cocaine is out of the way. I find a similar kind of thing with women who are cocaine users. Once you take away the cocaine, then you see them sitting with an eating disorder. That the eating disorder has always been there, and actually the cocaine started to be used as an appetite suppressant, and then they just got more involved in the cocaine. And the eating disorder has always been there, but the focus has been taken away from that. Then you go into recovery for the cocaine, and then the eating comes back. And it's a very similar thing with sex as well. And sex and eating disorders also go hand in hand a lot of the time because of that body dysmorphia, the whole shame around the body. Yeah.
Got it. One one more question. I'm sorry, I know we're going over your time. You have time for one more question.
Yeah.
Okay. Now, can you believe I've forgotten it? God. And it was such an interesting one. Oh, yes. Okay. So sometimes I will be referred a sex addict or, a couple. And I often get told I'm not allowed to have sex because I'm a sex addict and therefore I'm not allowed to have sex. So I'm always struck by this because, and I know we've touched on it before earlier in this conversation, because sex is something we have to do. We have to do it consciously, though. So tell me a little bit more about that.
Okay. I know the 12-step program, and I'm going to go into very like touchy waters here because I don't want to step on toes on the 12-step program because it's the most phenomenal program. However, mostly the 12-step program preaches abstinence, and
Mm,
similarly in the process or addictions as well. They say that a sex addict, a lot of the understanding is that if you are a sex addict and you go into recovery from a 12-step point of view, you need to stop doing all sexual things, which is masturbation, pornography, sex itself, etc. Um, I don't believe in that. I think that's exactly what you're saying. Is that sex is a very natural thing, and actually masturbation for somebody who is a sex addict in recovery can be a wonderful way of managing his sexual outlets, which are normal and healthy. Just because you are a sex addict, you you know it's healthy to not want cocaine to live in your life. It's not healthy to not want sex to live a healthy life. So to cut
mm,
all sex out of your life when you're trying to live a healthy way doesn't really make sense. But
mm.
it's what I described earlier is that you look at it's not healthy to have sex with a sex worker. So you want to cut that out completely. But it will still be health. It will be healthier to have sex with pornography. So pornography is not a healthy thing, but sometimes it's you can't cut out everything all at once. So somebody who's involved in sex workers and exhibitionism and everything, and who also does pornography and masturbation, I would leave the pornography with the masturbation, and then slowly get the person to just masturbate without the pornography. That's ultimately where you want to go, or get the person
Right,
to have sex with his wife, with his partner, without any other kind of toys or anything involved. But with a
right,
pornography addict, it's then it's different because often I will have a pornography addict saying to me, I don't want to masturbate and I don't want to do pornography because if I masturbate, it's going to make me want to use pornography. And so he chooses himself to try and do abstinence. And for a period of time, it's not a bad thing. There's also this thing called PIED, which is porn-induced erectile dysfunction, and the only way that
correct.
you can get rid of that, what that is that it's a tolerance to more and more pornography. So the person can actually not get hard and get an erection and have an orgasm just with normal, vanilla kind of pornography. He's now needing more and more and more. And in order to get rid of that problem, the individual has to stop watching porn completely and often stop masturbation completely as well. So it really depends where you are, on what level, and that's why I think it's quite important to do recovery with a sex addict on a very individualized basis, looking at his own specific recovery plan, and that gets moved around if needs be. Like maybe they want to do a 40-day abstinence and then they actually can't because they feel like they're going to explode. Then maybe that you need to, look at something else. And so I think, that subjective way of dealing with each individual according to his own specifics. And unfortunately, the 12-step program, which is a large, it's a program for a large population, can't do that subjective individual kind of recovery. So there's more often than not, they still say that abstinence is better, but on a personal level, I don't think so.
Thank you. Thank you very much. Wow, that Sharon, I can learn, as I said, a fortune from you, and it's been very, very, very. It's been a real pleasure to have you on. Totally not taboo, and who knows, we can definitely make this another one to be continued at some other stage. So thank you again. I just wish you a very, very warm and restful weekend. Please be safe, healthy, and warm. And again, thank you for agreeing to be my very special guest today.
Wow, thanks for letting me come on and talk about my passion.
And I can see it is a very big passion. So, Sharon, you're also a member of the multidisciplinary team on my sexual health. So, if anybody does want to get hold of you, do you have a website, or can they Google you, Sharon Rosen?
Yeah, I don't have my own website, but I'm on a couple. But probably the best one is My Sexual Health, and then
Okay,
yeah, it's got all my details there.
fantastic. All right. Thank you
Yep,
again. All the best.
pleasure.
Bye.
Thank you.
Bye.
Bye.